What are the subtle signs of a focal seizure? Imagine noticing someone acting a little differently, but you're not quite sure what's going on. Sometimes, seizures don't look like the dramatic convulsions we often see on TV. Instead, they can be very subtle and easy to miss. That's why understanding these signs is so important for safety and quick help. Focal seizures start in one specific part of the brain. Depending on where they begin, the signs can vary widely. One common early sign is called an aura. This is like a warning that a seizure might happen soon. Auras can include strange sensory feelings like tingling or numbness, or a feeling of dizziness. Some people experience unusual tastes, like a bitter or metallic flavor, or strange smells that others don't notice. Visual changes are also common, such as seeing flashing lights, blurred images, or dark spots. Auditory sensations like ringing or buzzing sounds, or hearing voices can also occur. Emotional shifts are another subtle sign. Someone might suddenly feel very fearful, joyful, angry, or sad without any clear reason. Some describe a feeling of déjà vu, as if they've experienced the moment before. Others might have a stomach sensation, like nausea or a sudden feeling of dread. Hallucinations or seeing double images can also be part of this early warning. These signs are often brief and can be mistaken for other conditions if you don't know what to look for. In some cases, focal seizures involve small movements that are easy to overlook. For example, a person might have twitching or jerking of a finger, hand, or part of their face. They might make repetitive motions like lip smacking, chewing, or picking at clothes. Sometimes, they hold unusual postures or repeat stereotyped movements, like holding their arm in a fencing position. During sleep, subtle rhythmic leg movements resembling bicycling can happen. These tiny movements are often mistaken for nervous habits or fidgeting. Changes in awareness or behavior are also signs. The person might stare blankly, seem confused, or not respond normally. They may perform repetitive actions like walking in circles or rubbing their hands without realizing it. Speech can be affected, making it hard for them to understand or communicate clearly. These signs can be very subtle but are important clues that a seizure is happening. Other less obvious signs include sudden mood changes that are unusual for the person, like unprovoked laughter or crying. Facial expressions might shift unexpectedly, or they might suddenly sweat, blush, or notice a change in their heart rate. These autonomic signs can be easy to miss but are part of the complex picture of focal seizures. Recognizing these subtle signs is crucial for safety. Since these seizures often don't involve dramatic convulsions or loss of consciousness, they can be overlooked or mistaken for other issues. If you see someone showing these signs repeatedly, or if they're new, it's important to encourage them to see a healthcare professional for proper diagnosis and treatment. In seizure first aid, understanding these signs helps you respond effectively. Stay calm, keep the person safe from injury, and do not try to restrain them. If you're unsure or if the signs worsen or last longer than a few minutes, seek emergency medical help. Always remember, each person's experience with seizures can be different, so professional medical advice is essential for personalized care.